simple things like anxiety. Oh, take an anti-anxiety medication. But in Chinese medicine, we distinguish 13 different types of anxieties. So how do you treat that with one pill, right? Or an herb or an herbal food? You have to diagnose it and understand where it's coming from.
Mm-hmm.
Right? And to do that, you also have to understand someone's experience of the world, because that's in essence what it really is, right? We're not just looking at a symptom in isolation, right? This whole idea of the scientific method being the gold standard for understanding and diagnosing and looking at correlations and causation. Like, have you ever seen in the real world a one-to-one, elimination of all factors besides two things? Right? We live in a world where we are exposed to everything simultaneously, and we have to be able to understand all the correspondences and piece these things together to see the way this particular individual is experiencing the world and how the world is impacting the particular individual.
Hello, I'm Sumayyah Simone, and you're watching What's Your View? I have two guests with me today, Ann and Ross Rosen. And if you remember a past episode, and if you haven't watched it, you have to go back and watch it. Ann Rosen was here, and we were talking about Chinese medicine and really talking about alternative ways to think about health and immune health. And, immunity is on everybody's mind right now, and we all want to be healthier. So today we have Ann and Ross, who practice together in Westfield, New Jersey, who practice acupuncture together in Westfield, New Jersey. So welcome, you guys.
Thank you. Thanks for having us.
So I guess this is a sort of a continuation to our conversation, and where we were talking about like immune health and ways to look at it and ways to think about it. I really think we all want to be healthier. I mean, I think most people, everybody has their different approaches to it. But I'd really like to kind of dig deeper with you guys on this subject.
Yeah, I mean, we started talking about how one size does not fit all, and that's still, we have to go deeper than that too, as we went from sort of wanting to reject certain protocols within the Western paradigm to adopting a lot of protocols within alternative paradigms. And I think sometimes in sort of an acute setting, you can see the necessity of that, needing to have some set of guiding principles. But we want to still continue to keep our eyes on the terrain and the specifics and individual pictures. So I wanted to bring Ross into this conversation because he's really good at this conversation too.
Yes, thank you, and welcome, Ross.
Oh, thank you so much.
So when you say terrain, go a little deeper for me about what you mean.
If you think of, the impact on our health as a dichotomy between some type of external stress and the internal terrain or the landscape or the constitution of the individual, right? So that constitution or terrain is made up of many different factors, from genetics to early life experiences, where we all know the impact of traumas, right? And these adverse experiences early in life and what they do to the internal dynamics and terrain, and the sequela or the downstream impacts of what that does to our health. And because of that, and we could throw in there lifestyle, right? We could throw in there, how much sleep does someone get? What's the kind of diet someone eats? How much exercise does someone get? What's the type of exercise? What is the impact of that exercise? And so all of these things impact the way that our bodies act, right? The way that they experience the world. And so if you have a particular stress that comes from the outside, whether it be a virus or a bacteria or just work stress or whatever it is, that's going to impact different terrains differently, right? And so if you're, one of the examples that we always give in Chinese medicines, we always hear about this idea of particular herbs or medicines treating a particular thing, right? Like one of the famous ones is, ginkgo treats memory loss, or ginger treats nausea, right? These things don't act that way. Things don't treat particular symptoms in that particular way. They have actions, right? And the way that action is received internally by a particular terrain and dynamic of that individual. So ginkgo helps with memory because it improves blood flow to the brain. If your memory loss has nothing to do with blood flow to the brain, you can take all the ginkgo you want, you're not going to have a better memory.
Right, specifically microcirculation.
Right, and same, ginger has a warming dynamic on the stomach. And so, and it also gets rid of phlegm and all these different types of damp and accumulations of turbidity that might reside in the stomach. And so if your nausea is caused by that, it will be very helpful. However, lots of people's nausea is caused by stomach heat, right? Inflammation. If you take ginger, you're going to get way more nauseous. So if you don't understand the dynamics of that individual's terrain, you can't really match up a proper therapeutic action, right?
That makes sense.
Know which, because ginger doesn't treat nausea. It has a particular action that it does. And if your nausea is caused by that dysfunction that herb can treat, then it will remedy your symptoms.
That makes sense. So, and this is something you don't really hear people saying or really even thinking about. They say, okay, I'm nauseous, let me take ginger, with no thought to what's actually causing the nausea.
Right. Or I've got a headache, let me take Advil, or, that can go on and on and on with these types of correspondences.
Right.
But they are not, that's not the way these things work. Right. And we have to understand, we have to, like what you're saying in this episode, dive deeper and explore more about the
there's so many kinds of headaches. Some of them are excess headaches, some of them are deficiency headaches. Or do you have too much energy up here that you need to get out, or can you just not get enough energy up or blood into your head?
Yeah.
Right.
Or something, a lot of different ways.
Or something, for like simple things like anxiety. Oh, take an anti-anxiety medication. But in Chinese medicine, we distinguish 13 different types of anxieties. So how do you treat that with one pill? Right, or an herb or an herbal food? You have to diagnose it and understand where it's coming from. Right, and to do that, you also have to understand someone's experience of the world, because that's in essence what it really is. Right, we're not just looking at a symptom in isolation. Right, this whole idea of the scientific method being the gold standard for understanding and diagnosing and looking at correlations and causation. Like, have you ever seen in the real world a one-to-one elimination of all factors besides two things, right? We live in a world where we are exposed to everything simultaneously, and we have to be able to understand all the correspondences and piece these things together to see the way this particular individual is experiencing the world and how the world is impacting the particular individual.
Right. That makes sense. So basically what you're saying is that you have to think about who the person is, right? Who's actually, you don't just treat the body, you got to treat the spirit too.
Right.
Oh, yeah.
Are you guys hearing me okay?
Yeah.
Oh, yeah. Can you hear us?
Yeah, I can hear you.
Yeah. Okay.
You have to actually treat the whole picture, which is, you don't hear a lot of that in this westernized way of thinking. It's like, okay, 10 people have a headache, 10 people take Advil. Or 10 people have, and even in a holistic movement, right? Those of us who want to move away from the pharmaceutical model and who are reaching for the ginger, 10 people have nausea, 10 people use ginger,
right?
Even though there could be 10 different causes for the nausea. Yeah. And that's why some people will say, I tried that ginger and it didn't work.
Exactly. Yeah. Exactly. Because they weren't using it properly. It wasn't the appropriate medicinal. Our modern world is really rooted on this idea of control. We're trying to control the environment. We're trying to control our experiences. And that, we have artificial lighting, we have artificial heating. The seasons don't matter to us in the same way anymore, but our bodies are really microcosms of the greater macrocosm. And we have to find alignment to that. And so to do that, you cannot eliminate every other factor besides two things and to see how they impact each other. I mean, you may find some impact here, right? Like, certain things have certain energetics, and a lot of people, we're all human. We share a certain genetic similarity in many ways, and so we're going to respond to particular things with similarities. But to get to a point where we're treating with medicinal and we're trying to fine tune someone's response and create healing, that model is not very efficacious.
Yeah, I mean, even you think about like stomach aches. I've been watching dynamics with like middle school and high school kids for years, and you think about lunch is going to be a very different experience for kids who are. It's yes, partly about what you eat, but if you're sitting at a lunch table every day or trying to figure out where you can sit at a lunch table and you feel bullied by some of the, I mean, so all of those factors matter deeply to us, not just what you're putting into your body, but the environment. Are you eating too fast? Are you in a stressed out environment? Do you like the people that you're eating with? Like those things all factor in, and really in our practice of medicine, resonance is huge. He teaches about the impact of resonance in terms of how well people really heal and recover. If people feel like you get them, it makes a pretty profound impact. That healing relationship is really important too.
Yeah, I mean, there's a difference between figuring out a diagnosis for somebody and giving them a treatment versus speaking with them, explaining the dynamics of that illness, seeing the resonance back and forth interpersonally, and the person going, oh yeah, that makes a lot of sense. Because what that does is it starts to sort of unwind and untie these knots that have been formed energetically by these particular imbalances. And so that's really the initiating trigger for the healing process. And then the acupuncture, the herbal medicine formulas, the supplements, the diet changes, then those things become way more profound in their impact.
Right. I've had doctors like tell me a diagnosis, and I said, no, I don't think that's it. And they said, well, I'm the doctor. And I'm like, well, I'm the patient. It doesn't,
exactly.
Like it doesn't ring true to me.
Yeah, it has to resonate with your experience, right? That's an important element to it.
Right. That makes sense. That makes complete sense. That you can't discard the soul and treat the body separate from the soul. Like something in there has to be harmonious.
Yeah, that's
right. Any type of resistance will be detrimental to a healing process, right? So in Chinese medicine, we have this saying, this definition of health, which is the balance of yin and yang and the smooth flow of qi and blood. So things aren't flowing smoothly. If there's knots and resistance in places, then you're not going to get a full healing response. And that smooth flow of movement is different for me than it is for Ann, than it is for you. We all have our unique ways that our energy should flow in the world based on lots of different things. We can call it karma, we can call it genetics, we can label it with lots of different ways and names. But the reality is we have to understand the way that individual should be harmoniously flowing with their own experience of life, and help to engender that movement for them.
So, and this is why the choice aspect, right, that we are all looking at right now is so important, because if you can't be forced into a certain way of healing, that's not healing, right? No, that's not, so the element of choosing how you heal, choosing how you breathe, choosing how you eat, regardless of whether that's someone else's choice, it has a different impact on you. I think taking away someone's mask, if they feel like they need it, also has an impact, right? That is the nature, the importance of being able to get behind your own healing process.
Yeah, and the flip side to that, and sometimes the uncomfortable side to that, is that it requires someone taking responsibility for their own healing. Right? You can go to a doctor and you can take a pill, but you now completely remove that person's responsibility from that healing dynamic, right? And that separates them from their spirit and from the movement towards a place of health and well-being. right?
Right.
So this is a tricky area because it is more difficult to take responsibility and realize and come to these conclusions that, gee, maybe my type 2 diabetes is influenced by my lifestyle.
Mm-hmm.
And to change that lifestyle rather than just saying, well, you're going to just take this pill and do all the same things you were doing.
And that realm right there is the obstacle in the smooth flow of chi, right? Whatever is happening in there with the resistance to either knowing or taking responsibility. And I think, what we try to do and what your conversation is trying to initiate is this idea of empowerment, because
Mm-hmm.
to remove some of those obstacles, people have to feel like, wait, I can do something. I can take responsibility, and it can feel empowering and good, and I can make a positive difference and feel better. We're trying to find whatever that sweet spot is, and that can be different conversations for different people. Sometimes there's fear, there's different kinds of resistance and different kinds of obstacles.
And also, which I think is important too, because I think sometimes the first place that can go in a pathological way is blame. And it's not about ever blaming the patient for their problems. It's about explaining, exploring, right, understanding, creating resonance in how we are sort of co-contributors to our pathologies, right?
Mm-hmm.
And so that when you wind up going into see practitioners where there's this big sort of power dynamic imbalance between like the almighty doctor in the white coat and the patient who's sitting down below, and we say, well, you did this and this is your fault. That's not what we're talking about. We're talking about sort of an understanding and the contributions that we all play in our own disharmonies.
Right. And it sounds to me like you're also saying that as healers, you're not in a parent-child relationship with your patients.
Right.
Right. That you bring to this your knowledge of healing, but you're there to guide the patient in taking power into their own hands to heal themselves and to play an active role.
Right.
It's an empowerment role. Yeah, we empower our patients, right? And we work together in co-creation.
It is collaborative. I mean, because we're ultimately not telling people what to do.
Right.
There's recommendations, and we're asking people where they're willing to meet us a lot of times.
Mm-hmm. Right. And I'm sure there's times where some of the healing has to actually happen here, right? Where the person, it may seem simple. Okay, you just do, A, B, C, and you'll feel better, but they're not ready. Mm-hmm. They might be ready to do A, but may not be ready to do B.
Yeah,
right?
I mean, and a lot of it has nothing to do with the needles or the herbs or the treatments, right? With the patient that we were speaking, we had a patient the other day who said the best thing about their treatment on a particular day was we were just talking about how you talk to yourself. So I said, go find a photo of yourself from when you were a child. Look at that photo. Don't say anything to yourself that you wouldn't say to that child. Mm. And that was the thing that they were able to take home on that day and sort of empower them into some different kind of thinking, right? So it can be, it's where you find the resonance, I think.
Right.
In medicine, right?
Yeah.
Right. That's actually awesome. I know I've had experiences and literally like, I guess the way the Western model sees medicine and healing doesn't vibe with me. Because to me, I'm like, I want to be a part of this process.
Yeah.
I want to be a part of the decision making. And if something doesn't feel right to me, I want to say, that doesn't really feel right to me. Yeah. And not be yelled at and told that I'm not, respecting their years of experience and, yada, yada. Right. Mm-hmm. But I really think that this takeover by one model of healing has to come to an end.
Yeah.
That there's all these different ways, like you guys practice Chinese medicine and acupuncture, but there's all these different ways to look at healing.
And I would argue that it's not a model of healing that is dominating things right now. It's not healing.
It's not healing, no. It's definitely not healing.
Yeah.
Which is sad because there's a lot of healing that needs to be done.
Oh yeah.
You know, but like I said, I really want to put a lot of energy, and not just to what we're saying no to, but what are we saying yes to, right? What do we want to see more in the world? I want to see more of you guys and others like you who are actually bringing the opportunity for people to heal.
Yeah.
You know, to actually be able to look at themselves and be able to take their own their healing journeys into their hands with your help and encouragement and with your knowledge, you know. So when you look at let's say you have, like I think I said this in our past episode, Ann.
Yeah.
When you look at something like COVID, right?
Mm-hmm.
Or any virus, it hit my family and all of us had different presentations. And so, Ross, you talked about like, okay, COVID would be seen as an outside stressor, right? And all of our different constitutions reacted differently.
Right.
How would you help people to understand that? Like, how, you know?
Well, this goes back to this idea of signature, right? There's different signatures that are embedded in particular pathogens, or I mean everything, right? Herbs, right? Things, it makes a difference. An herb's functions that is determined by where it grows, the amount of sunlight it receives, the amount of moisture it receives, the temperature, right? All these things dictate the action that it has internally, right?
Mm-hmm.
So how does it, its taste, its nature, the affinity towards particular anatomical areas that it resonates towards, or organ systems that it impacts, right? All of these things are significant. And the same thing with external things, right? So something like COVID has a particular nature to it, right? In Chinese medicine, you know, one of the main ways that I see it is what we call a Xiaoyang pathogen. So a Xiaoyang, it means, it basically means like a lesser yang, or it impacts, it's sort of like, it impacts a middle layer between the external and the internal domains of the body. And so you start to see particular things that resonate with it. So things like, you know, bitter taste in the mouth, and rib side pain, and alternating fever and chills. And there's some particular symptoms that tend to align with that. Mm-hmm. Now, if you're somebody who has a very strong immune system, when that comes into the body, and it confronts that level of energetic, right, your own immune system part, it could thrust that out very forcefully. It can maybe push it out to another layer. It can allow it to go deeper into a deeper level of internal dynamics and energetics. Mm-hmm. And so if that happens, then you're going to see the symptoms play out in the domain with which the pathogen resides. So if it goes internally, you may see things like all the different digestive problems and nausea and diarrhea, and the impact on the microbiome, right? The microbiome is a major player in the immune system, right? And so we see a lot of dysfunction in microbiome with people who have COVID infections, and people who have pre-existing issues in their microbiome will be the ones who tend to get sicker, right? We've seen that people who are diabetic, kidney disease, all these different digestive problems, they're the ones who, in the beginning, were the ones who were falling prey to more of the significant complications, or the elderly, who these energetics start to, you know, wane over time as they get older, right? But when you look at the nature of the pathogen itself, we see unique dynamics, right? We see a spike protein, right? That's unique. We see elements of things from nature that were artificially injected into this particular sequence, right? So things like, you know, bat, right? If you think about bats, you know, bats live in caves. The bat caves were like super important during wartime, because they would extract the elements from the guano, right? And they would make gunpowder with that. Right? So part of the nature of the bat is to create certain types of inflammatory things, right? And you look at part of what happens from, you know, there's elements in the protein of snake venom, right? What does snake venom do when you get bit? It causes a rapid coagulation of blood, right? So now we start to see all of a sudden different elements of what COVID, how it manifests in the public. It creates inflammatory responses. It creates blood stasis and circulatory problems. And that's what the Xiaoyang is. The Xiaoyang is part of the circulatory system in Chinese medicine. So all of these signatures, all of these natures, without even, if we just saw what this sequence was in a lab, someone who's skilled in Chinese medicine could predict the types of signs and symptoms that this would manifest in a patient internally, right? And we're seeing that play out. It bears out clinically with what we see throughout the world right now. So if you understand that, then you want, and of course the spikiness of the protein, right? So when you look at, it's interesting, when you look at like pulse diagnosis, when you look at, so in my lineage of pulse diagnosis, we can distinguish roughly around 90 different sensations on the pulse on the radial artery. And each one of those sensations give me an idea of what's happening energetically in the body. And so there's a pulse quality that we call choppy. And choppy basically looks like, it's like if you rubbed your finger on a zipper, right? Like all these little sawtooth aspects to the vessel wall that we're experiencing. That's like seeing a spike. It spikes all over the vessel wall, right? And so the spike protein combined with the inflammatory nature of this particular sequence and some of the dynamics of what like the snake venom or this toxin can do, it's creating a coagulation of blood in people. And we can perceive that right away from touching someone's radial artery, right? If you're skilled in that method of diagnostics. And so all of these things are resonant with the nature of the pathogen itself. Now, does that mean that every single patient is going to experience that? No, because maybe my circulation is really, really good. And maybe I'm going to be able to overcome the dynamics of that because my own immune system and my circulatory system are working efficiently, right? But someone who maybe is elderly, elderly people tend towards blood stasis anyway as they get older, right? We see elderly people with, their liver spots on their hands and so forth. We see lots of spider veins and varicosities. These are signs that the blood has been stagnant over long periods of time from taxation over decades. Mm-hmm. They're going to fall prey to the blood stasis component of the COVID
and
problem,
you can
right?
feel the stickiness of their blood prior to, there's a predictive measure too, that you can sort of feel who is more vulnerable, who is more sticky, who are the spiky things going to stick to more readily and be able to, change the environment more readily. So those are the things. It's really interesting too that one of the herbs, lulutong, what is the?
Like those little itchy balls from,
that fall from the trees, those little spiky looking things.
Mm-hmm.
So that happens to be an herb that treats
really?
Coagulate blood, yeah.
And one of the main ones that we see is berberine, right? So berberine comes from barberry, right? Which, if you look at the actual the leaf and the stem itself, it's all full of thorns. So right? All those spikes all over the place, and it's one of those herbs that has that signature to reduce inflammation and promote blood flow at the microcirculation level. And so that's why tends to be a really nice supplement for people who have that particular presentation. And not saying everyone should do it, right? So it's not about
But a number of the Chinese herbs that have been shown in clinical trials to be helpful for COVID have berberine in them. That's
wow.
So these things sort of come together, and understanding it from a different way. The healing preceded the science. These things have been studied for a long time before they were endorsed by the science.
Right. Thousands of years, right?
It's one of these jokes we have in Chinese medicine all the time. There'll be this like landmark study comes out showing, this treats this. And now we understand why. Like, we've been saying that for 3,000 years.
Right. So basically science is a baby. Like what we call science, right, is a baby, right? Like a toddler. Because
we're using this newer model to try to validate things that people have said over thousands of years.
Yeah, in its essence, science is an investigative process, and that's what we all do all the time. Mm-hmm. It's just that right now, our modern world is elevating a very particular way of investigating that really is more delimiting than anything else. We're trying to create a larger incorporation of ideas and philosophies and signatures rather than just kind of like, reducing everything to this like significant reductionist approach.
And it would be one thing if it didn't dismiss all of the other observations, right? I mean, all of those other observations are where we find the things that those scientific method is going back and looking at these observations first. The observations matter.
Well, I mean, you think about so many of our Western drugs even have come from chemical constituents from Chinese herbs. Right. It's a common thing we see. We see aspirin, we see digitalis, we see lots of things that have come from this recognition and understanding. The problem is that instead of thinking, what do these other systems have to offer us? Instead, the current pharmacological model is it doesn't work until we tell you it works, until we can prove it in a lab, and that's problematic.
But when you look at human development, right, like, and you look at the mind of an infant versus a toddler, right? Humans go through this stage where they, it's me, mine, no, right? Yeah. I feel like modern science is literally hasn't passed the toddler stage.
Right.
I don't know that they've passed the infant stage yet. And that's not necessarily a put down, but it's if you look at how we're operating right now.
Yeah.
How do a 2-year-old won't have a value for all the wisdom that its parents and grandparents have.
Yeah, it's a messy evolution right now, isn't it?
Right. And so that to me, I can see that. Like, I'm just like, okay, how do you throw out thousands of years worth of observation and science and medicine that's been working all this time?
Right. I mean, so many good ideas came from the very beginning, I feel like, of the pandemic, right? You were communicating with peers out of China. Mm-hmm. And some of the herbs they were talking about then that really gave us clues as to what was going on, as he was speaking about before. But you were hearing about formulas from the...
Yeah, they were on the front line treating this with Chinese medicine, in China. And so they had, white papers were coming out every few weeks about the different presentations, the different herbal formulas that were matching up to those presentations, the success rates of those herbs and so forth.
The malarial types of presentations. Mm-hmm. Yeah.
It's funny because I remember walking in the park this summer and, you see the little spiky balls. And I remember literally looking at them and thinking, wow, this looks like a spike protein.
Yeah. Yeah.
So now you're telling me that that's actually a treatment that could work.
Well, we're not saying the treatment. We're not saying it's a treatment for COVID. We're saying that herb in nature treats blood stasis. It treats coagulation of blood. And so it's not a surprise because it has a signature. So it might be an interesting thing for someone to go and, investigate whether or not that's something that would be useful as a part of a overall formula tailored to an individual, right, who had this problem.
Right. So in nature, there's such intelligence that it almost seems unbelievable.
Yeah. Mm-hmm. Oh, all the time. Mm-hmm.
That if you're actually paying attention and asking yourself questions and listening to the questions that were asked and answered over thousands of years, that you might actually be able to figure out a few things.
Yeah.
This is how our ancestors did it. This is how the ancient Chinese figured out a lot of these things. This is how the Native Americans decided, how to understand plant medicine and to listen to these signatures and to understand them.
I'm often going for walks, out and around nature and seeing especially over the past couple of months, lots of mushrooms coming up, right? And when I see the sap running off the trees and different things where I'm feeling like, wait, what is this? What are you giving this to us for? What's this? What is this doing for us?
Right.
I have a lot of curiosity about that because I do feel like that the clues are popping up all around us.
Right. That nature is literally giving us the answers to our questions and the solution to our problems. How much are we paying attention?
Right. We talked about it last time with the Artemisia. That's kind of growing everywhere.
Right. I know in Africa, there are several countries that have been looking at traditional healing methods for COVID as well, and have been successful. Mm-hmm. So all over the world, really, I think this has pushed people to rethink. Right? To rethink on individual scales, nations are being required to do it. Some nations are doing better than others, depending on what their motivations are. But we're all being required to actually think differently. Ross, I want to circle back to something you said about the pulse and what you can read off the pulse. I find that really, and I've been to your practice before, like years ago, and I just found that really amazing that you could take somebody's pulse and read stuff like it's a pulse, like a beat, 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 and you're picking up all this information. Talk to us about that. And audience, please, in the comments, like, show some love to Ann and Ross. Ask some questions. If you have questions, we can come back and answer them. So put what you're thinking and what you want to know in the comments. So, I mean, talk to us about this.
Yeah, I practice a couple of different lineages of pulse diagnosis, but in one of the main ones, we have this understanding. It's sort of like a holographic representation. And again, we talk about signatures. Everything energetically has a signature, all these different types of movements and actions. And so within the space of the radial artery, within the first really couple of inches of the wrist, we can see a mapping of the entire anatomical landscape of the body based off of the organs and particular very specific areas. We can tell what's happening in the mitral valve, in the heart, or in the left lateral lobe of the lung, and so forth. And these anatomical areas kind of create our sort of, they give us a mapping of the energetics. And then within these areas, we have different depths of pressure that relate to the superficial versus the deeper levels, more like the actual organ tissue themselves. And there's actually 9 different depths of pressure that we can calibrate from the skin all the way down towards the bone. And then what we're feeling in the actual movement of the vessel itself and through the vessel is there's about 90 different discrete sensations. And the way that those sensations combine themselves in each location or depth tells me about what's going on with a lot of detail in the different organ systems and anatomical areas of the body. So it kind of creates a sort of energetic blueprint of someone's health, but not even just in the present moment, because it also tells me about what's happened in the past, tells me what's happening now in the present, and also helps me predict what's going to happen into the future. So it really kind of creates this very subtle and sophisticated model for understanding process of what's happening. So it's not just a snapshot, take an x-ray and see a snapshot of someone's lungs, but I can look into the lungs and see what's going on right now, what led to the development of that current process, and where that current process is going to lead into the future, right? And so I can tell what's happening in lymphatic flow, in terms of blood flow, in terms of circulation of just regular energy. You can tell what's happening in the brain or in the kidneys or in the pelvic lower body. You can see if there's cysts or fibroids in the uterus or tumors on the ovaries or prostatitis, or there's all these levels of sophistication when you understand how to read those energetic signatures that are presenting themselves to you. It's just like it's just me or anyone practicing these models touching and understanding the signs of what the body is giving, right? So you can say, oh, I can cough and say, oh, there's something going on, maybe irritating my lungs. But what is that cough caused by? Is it dryness? Is it phlegm? Is it inflammation, right? And then you can access those areas anatomically and get a sense of what's happening there. And then from there, give the proper sort of remedy or treatment.
So he has been feeling someone's pulse before, for example, and been like, wait, do you carry your phone in your front left pocket or something like that? Because that's where he's feeling certain impairment to the circulation due to a heat process or a toxicity.
Right. Sometimes, you can tell if someone has been stuck in the birth canal during a traumatic delivery, or had the cord wrapped around their neck to the point where they were being deprived of oxygen and becoming cyanotic. Right. There's all these different layers of energetics, and you could tell, breast cancer. You can tell not only can you tell if someone has breast cancer, you can tell if someone's developing breast cancer before it manifests. And actually, that's really useful because then you can, of course, treat and prevent problems. So it's understanding process and movement once you become attuned to the signatures and the signs of what the body is revealing itself to someone who is trained to listen properly.
Right. I mean, you sound like all of this from a pulse.
Yeah. Well, I mean, you have to layer in the underlying dynamics and understandings of Chinese medicine and theory and so forth. But when you can,
and it takes a long time. It's a lot
of
cultivation. We can't all I do not trust my pulse taking on the level that he can do it.
Right. And I know it's true because you've done it with me. Like you've read my pulse and said stuff, and I'm like, it's impossible he could know that. Right? Like,
pulse. It's teachable too, which is great, right? It's not like it's really, it seems to be this sort of like very mystical, mysterious thing, but it's a very logical, rational understanding of interpreting information that the body is giving you. It's just tapping into it.
So basically, if I were going to make this a broader, look at this in a broader way, when my heart beats, I'm vibrating everything that has happened to me and how I'm resonating now. Like, and you read that resonation on my pulses. Am I right?
Yeah. I mean, essentially, in Chinese medicine, we call the heart the emperor, right? Or the empress. And so whatever happens to the heart, it's going to affect every single subject and minister within the empire, right? And so we tap into the layer of the heart, but then we also can see the relationships of that heart and the vessel to all the other varied organs and systems in the body and interpret from there.
Wow. That's fascinating and sounds more effective and efficient than an MRI, right? When you go into that.
You can get, in many respects, that layer of detail and sophistication. I mean, I've had lots of times where I've had patients come to me in acute cases, and I had a patient who was sort of doubled over in pain with stomach abdominal pain, and they came to see me, and I said, I think you have an ulcer based on your pulse. And they went to the doctor. The doctor was very concerned, brought them into the hospital, spent 5 or 6 days doing invasive testing, right? Gallbladder, this and that, and all these blood work and things. And then finally to come to the conclusion, yes, we finally did the endoscopy and you have an ulcer. So it's like, you think about someone coming in here and spending a couple of dollars for an evaluation versus like tens of thousands. This bill was like tens of thousands of dollars in the hospital. And then to get discharged saying, just
have an ulcer.
Yeah.
Right. I think we need to go back to some basics. And we also need to be thinking about tomorrow too, because how do we reproduce you, right? And when I say that, I mean, we're going to need to have our children thinking about learning your skill, right? So that it can continue.
And for all of us sharing all of our skills, right? Because I feel like there is such a big community of people that are really trying to tune in and listen to their bodies and learn skills and like pay attention to nature, like all of the things that are available, lessons available to us in nature. I feel like there's a lot of different, the Chinese medical paradigm, that's one tradition, but there's a lot of traditions that we're trying to tap into and learn from each other. We need those skills for sure.
Absolutely. Absolutely. And this idea that there's so much information in your heartbeat, in
your tongue, you can that's the only muscle that in your body you can actually take a look at. Really, your tongue coating can tell you about the state of your digestion, right? The tone of your tongue, whether you have tooth marks on the side, will tell you something about the state of your muscle tone, the state of different organ systems.
And there's also particular signatures. We call it COVID tongue, right? There's ways that COVID presents and how it creates changes in the body, the color, the coating, all of these aspects of what we look at in tongue
You want to
diagnosis.
describe the COVID tongue? Or?
Well, it's not just one thing, but the COVID tongue generally starts to become very red. And what you start to see is that and this also, people bring their pre-existing tongues to their ailments, right? So it layers onto a pre-existing tongue, a tongue that becomes much redder, because that's the heat and the inflammation that's building up internally. But also the coating on the tongue starts to become a very sort of greasy, slimy, yellowish coat. And when that has been percolating for a period of time, it actually starts to get brown. And then it's very slimy and greasy. And then it also starts to have areas of the tongue that start to get peeled, where the coating starts to come worn away, and you start to see the actual body of the tongue itself without any sort of moss on it. And that shows me where the heat is actually burning off the fluids, and where that inflammatory process is triggering a greater response.
Wow.
And under the tongue, we start to see the sublingual veins get very dark, like purplish and like blue purplish and almost black sometimes, depending on how much blood stasis has been and coagulation has been caused by the virus.
So there's a lot of info that so for some parts of it you can just look in the mirror and learn some things, right?
Right. I didn't think to look at my tongue, and none of us thought to look at our tongues to see, I didn't even know there was a COVID tongue.
Yeah.
That's really good information.
Yeah, it's a signature, so it's a commonality that we see across population. It doesn't mean that if you have COVID, you're definitely going to have this tongue, or if you don't have this tongue.
Or if you have a red tongue, then you're really, some people start with that, right?
Yeah.
Some people start with cracks on their tongue and coats on their tongue, all these different things. But it is a tool because it's something you can look at and track progress, or,
another correlation that we can create. And the more correlations we create, the more we're able to sort of like connect the dots in a way that's not just some general outline, but something that has a high level of specificity and detail.
Right. So now everybody's obsessed with COVID, but when you think about it, there's how many viruses out there that are, and people die from them too. Yeah. If your immune system can't handle it. Now, I'm not comparing them to COVID, but I'm just saying, as humans on this planet, there are challenges to our health, right? Lots of them bacterial. And so just this overall way of looking at health and realizing that we're all, one size doesn't fit all, right? And that there's all this information that literally pulsates through us all the time. Yeah. And there are people like Ross who can read that information. Yeah. I think it's just very useful to know, Yeah.
And it's also too, on top of that, it's, like the goal for us, like and probably I think really anyone who practices medicine is to become obsolete, right? That's what you want. You want people to be able to take care of their own health and well-being and live in tune with nature and so on and so forth. And one of the ways of doing that is really to be in tune with how are you feeling, right? And to give credence to how you're feeling, not just, oh, my blood work comes back and everything's in normal range, but I feel like crap. I've got no energy. I can't sleep. I'm anxious all the time. Like there's something going on there. And oftentimes we need to understand our own experience in the world. Again, not just what some expert tells us we're healthy because there's a blood test that tells us we're healthy.
Right. Everything looks good. Carry on.
Or, or the thing that we hear from our patients all the time is my doctor said it's probably just in my head. And probably just stressed. Like as if like psychosomatic medicine is some like horrible thing. Like it's all psychosomatics. Our stress, our mind, our emotions, how we feel and integrate and experience the world is always what causes our illness.
Right. And I think that's an important distinction to make too. Also, there's this whole concept, right? When let's say if they look at your heart rate, there's this normal range of heart rate. So you could be in a normal range, but be very sick.
Yeah.
Right?
Yes.
And not be outside the normal range. And they won't say, oh, wow, you're having a heart problem till you come outside. But you, especially for yourself, may have been sick for quite a while before they saw that.
Absolutely.
Yeah, and the way they choose those ranges too, I feel like is flawed. I mean, I feel like because a lot of very athletic people have slow heart rates, they sort of inferred like, okay, so a slow heart rate is a healthy heart rate. And we're not in our paradigm.
Completely opposite, in not completely. Not that a fast heart rate is good, but there should be sort of some target ranges based off of age and overall health and well-being, where that heart rate should be performing. And such. We have metrics for understanding a heart rate based off of other qualities. Because one of the things that happens very commonly is that, and this is the topic of my textbook that I published on heart shock and trauma, is that when you experience a trauma, your heart rate elevates, right? It's that fight or flight mechanism. And if the adaptive mechanisms in the body aren't able to bring you back to a state of homeostasis, what happens is your heart rate stays elevated. And when your heart rate stays elevated for a period of time, you get stuck in that particular state of trauma and fight or flight, right? Adrenaline is being secreted all the time. Cortisol levels are high. Your nervous system is tense and all these things. But what happens when you're 10, 20 years into that response? Your heart rate's not going to stay elevated because your heart is it needs energy to finance anything it does. And so if you're making your heart rate elevated for decades, right? And you can also now throw in your people who are marathon runners and who perform a lot of aerobic exercise daily. What happens is you start to weaken the heart muscle. And so that heart rate now starts to slow back down. And so you have to have some type of metric to understand where that person is based on their heart rate, but not just based on their heart rate. You have to look at other qualities to say, well, gee, this heart rate is normal, in a normal range, but what it's showing me based off of these other metrics is that you're actually weakening the heart because of A, B, C, and D that I can perceive. And I know where this is going, and I know what symptoms are going to follow based off of this. And I know how to intervene, more importantly, to correct it. Right?
Right. Which would be an important thing, I think, because when most people realize they have a problem with their heart, is when there's a problem, like,
too late usually.
It's bad,
Also, it's also sort of unravels because it's really not a mystery then. That when you see like, these basketball players, dropping with a heart attack, where people are like, he was perfectly healthy. Well, no. That does, you don't have a perfectly healthy person. If you're looking back at this picture, you're looking at a person who had elevated their heart rate as either through exertion or through an unresolved trauma or different circumstance where they were overworking their heart for many years to the point where that low heart rate represented a weakening of the heart or a deficiency condition, right? So there is a background picture
they were
that
poised
could be
for
more
that problem to manifest. No one saw it though.
Because of a range that people think I'm in it, so I'm good, right?
Right.
So our understanding of health and what it means to be in a normal range, I think needs to be sort of more deeply understood. And
Right.
And those ranges are so varied. Like, I'm not normal. I doubt you're normal, or no one's normal, right? There's no what does it really mean to be normal. What they're looking at really is more what's common. Common is not necessarily normal, and we have to kind of like separate, because those have been conflated for a long period of time. Like, oh, I get hot flashes and night sweats. Oh, that's normal. No, it's common, but it's an imbalance, and that process and change in life should be without symptoms. It's a normal thing to go through menopause, so it should be asymptomatic.
So you really shouldn't be experiencing that stuff during menopause.
But, it's sort of like we have to normalize things because everyone is chronically ill, right? Health is not normal anymore. Health is not even really common anymore. So we're sort of normalizing a background of chronic health into our picture of normal.
Right.
Which is why no one can really trust what they're feeling, because you're being told since the time you're little that all of your things are sort of normal, even though you don't feel well, right? I mean, you could have the explosion of autoimmune diseases and chronic illness over the past 30, 40, 50 years is mind-boggling, right? I mean, one of the things that I've always talked about is, and it'll probably be a chapter in a book that I write, is that why are we not as healthy as our grandparents were?
Mm-hmm.
Right? They didn't grow up on pesticides and all these chemicals in their foods, and like they were going to the supermarket eating fresh, daily, and they were cooking meals at night. They weren't getting fast food, and they weren't living in a world with like Wi-Fi and radio waves and all the stresses of a modern industrial world. Right? I mean, yes, they had their stresses. Don't get me wrong. They went through very stressful periods of time, but they were different. Right? They weren't constant assaults on the nervous system. Right now, we have constant stress on our terrain, and that terrain needs to respond all the time.
Right. And what can we even do about that? Because
get into nature, meditate, right? I mean, have a spiritual practice, right? Cook your own foods, eat local, eat organic, all those things that we talk about, that we sort of know. Spend time walking in the mountains, in the trees, go to the beach, go do all these things, be in nature, get away from your cell phones, get away from technology, all the things that we want to do to tap back in. Because in the end, if we are, right? So in Chinese medicine, we have this concept of, heaven, earth, and humanity, right? Heaven's on top, earth is on the bottom, and humanity is in the middle. How can we live a balanced, healthy life if we're not in tune with the cycles of heaven and the movements of earth, the seasons? If we're living in wintertime and we just put on our heat and we stay up until 2, 3 in the morning because we have artificial lighting on our emails, how can we get the proper movements and dynamics and recalibrate to the solar and lunar cycles? It's not going to be possible. And so by definition, we can't be healthy.
Yeah,
that makes so much sense. And I think you're going to step on a whole lot of toes, including mine, when you say that, because so many of us, with our artificial light that we don't even think of as artificial light anymore, because it's all we pretty much know, right? We don't go out as much as we used to. Right, because we don't have to. Like we're not growing our own food. We're not interacting with the earth in ways that our ancestors did because they had to.
Yeah.
But we don't even know what health and wellness and that synchrony with nature even feels like.
Right. Well, you think about 2 of the most common supplements that people are using, right? Vitamin D and melatonin.
Yeah.
Right.
Right. We talked about that.
These are your cycles that if you can't live in harmony, then of course you're going to have to keep supplementing with them to be able to function on a daily basis.
Yeah, but it's baby steps though. I mean, the hopeful piece is that we all have a way to tune back in. Even if we start by like today, go look in your bathroom mirror, look at your tongue, see how it looks when you feel good, see how it looks when you feel crappy, see if it changes at all, see if you have any scalloping on your tongue.
Or feel your pulse.
Yeah.
Right? Is your heart rate in a target range? Are you skipping beats? Are you speeding up and slowing down all the time? Or is it a nice rhythmic motion to that? Does it feel smooth? Is the amplitude, does the force at which it hits your finger consistent over time with each beat? Right? All these things are markers of your physical, mental, emotional well-being.
Yeah. Or just go for a walk. It's like there's there's so many places where we can pick up and shift and make a change. Turn off the TV.
Right. So change doesn't have to be like dramatic in like I'm going to make everything perfect in my life.
No, it shouldn't be really, because dramatic changes don't tend to last. Right? You want to make consistent changes over time and keep building upon them. It's like muscle memory, right? It takes time for a habit to stick.
Right.
Yeah.
Right.
You don't want to put your body into shock either with certain things, right?
Right. So we're running out of time, but I will say this. I want you guys to know where can people find you guys?
Yeah, well, we run the Center for Acupuncture and Herbal Medicine here in Westfield, New Jersey. And our website that you're pulling up now is acupunctureandherbalmedicine.com. And there's tons of information on that website. So I have tons of webinars and teachings and lectures and articles and information that you can spend weeks just sort of like going on there, reading and watching certain things. There's teachings on dietary therapy and a whole variety of different things that we do.
Wonderful. And you're located in Westfield, New Jersey, for those who are local. Also, you mentioned that you wrote a textbook. Can that be found on your website?
Yes. Yeah. If you look at the, I don't know if it's under the teaching section heading where you have there, or the products. I think it's under teachings.
Okay.
And it'll list the textbook Heart Shock that I've authored on. There it is. Yeah.
Oh, here it is. Okay, good.
Trauma. And so, yeah.
Okay. Because, you know, we have some people in our movement that like to learn, like me.
Yeah, all of us.
Right. Yeah. Because we want to know more about how to be healthier and how to take, you know, and just to understand what our bodies are doing and how to bring balance and what balance actually is. Because if you have some sense of what it is, now you have something to reach for, you know. And I think a lot of us have lost sight, you know, and it's not our faults. It's just the way, you know, our society, we valued certain things and have lost touch with some other things that were really valuable. So
yeah, I mean, I think we're all looking to revamp our toolkits. I want to learn to like farm and hunt. I want to learn all this stuff now.
Right. Right. It's causing us to really ask the questions about what's important.
Yeah.
You know, and what survival skills actually are. Right.
Yeah.
So
and part of that, you know, which I will say is it's resiliency, right?
Mm-hmm.
Part of survival is being resilient. And to be resilient, you have to take care of your body and your mind together.
Right. You can't ignore one over the other, right? Like take care of your body, but your mind is hurting.
Yeah.
Yeah.
You know, and we do that a lot. We don't, even our emotions, we ignore and kind of bury them, and we don't see them as important.
Yeah.
But if we broke our leg, we'd know we'd have to cast
right.
it.
And we have a lot of societal disease right now.
Right. Right.
Yeah, I agree.
So thank you so much, both of you, Ann and Ross, for being here. This has been a wonderful conversation.
Yeah.
And I know we're going to do this again because there's so much to unpack. You know, so many things to think about and talk about and understand. And I think this is a conversation that needs to be had, you know, and that we need to continue to have this.
Yeah, thank you for creating the space for it.
Yes, and thank you for coming. I really appreciate it. So thank you guys for listening. And